Please join us every week for a new episode of Understanding the Human Condition with Dr. James Flowers. Dr. Flowers and his most admired mentors, respected colleagues, and VIP guests will share valuable insight into underlying health causes, conditions, and issues. These in-depth yet approachable episodes are a great resource for both private individuals and industry professionals. Our esteemed host, Dr. James Flowers, is one of the most recognized and respected names in the field of chronic pain, mental health, and substance use disorders, both nationally and internationally. Dr. Flowers is the founder of J. Flowers Health Institute, located in Houston, Texas. For more information about J. Flowers Health Institute and its concierge services, go to jflowershealth.com or dial 713-783-6655. And be sure to mention this podcast.
Welcome to Understanding the Human Condition with our host, Dr. James Flowers.
Hey, Robin.
Hey, you.
How are you?
I'm good. How are you?
I'm doing fantastic. We have Chase Wade here today, Vice President of Clinical Services with J. Flowers Health Institute.
He's
hey,
our
Chase.
work
Hey there,
family. Yeah.
Yeah, work
Right.
family. That's a good way to say it.
Yeah, you are.
Yeah.
You are. So I thought I'd start, as usual, with a little bio about you for those who don't know you. Chase is a licensed professional counselor who is currently the Vice President of Clinical Operations at the J. Flowers Health Institute. Chase holds a master's in counselor education from Texas Tech University. He specializes with clients who suffer from chronic pain, somatic symptom disorder, depression, and anxiety.
That's a mouthful.
Welcome. I know. I was worried about somatic symptom disorder. I didn't even know.
Maybe we can get Chase to talk about what that is in a little bit.
Yeah.
Absolutely.
Yeah. So tell me how you came to J. Flowers Health Institute and how did you meet our fearless leader? And
Let's see. That was 8 years ago now, almost 9 years ago now. So I finished graduate school at Texas Tech. And like most graduate students, after an economic crash, we're all broke and living with our parents, and we don't know where to go.
Yeah.
So I leaned on an old friend of mine who I worked with in security at Hurricane Harbor in Arlington, Texas, not the one here in Houston. And he said, here, email this guy. So he gave me Michael Beard's email address. So I sent him an email, and probably about 2 hours later, I get this Houston phone number, and I just sent it straight to voicemail.
Have you heard this story?
No.
And I sent it straight to voicemail. And at the time, I was substitute teaching in a junior high. For some reason, they put me in charge of science. I don't know why.
Oh, wow.
And I get the voicemail, and I immediately call Dr. Flowers back, and I'm apologetic for sending him straight to voicemail. And we set up an interview about a week later. I met him at this office in North Richland Hills, which turned into being my home for 6 years to follow that. And the first thing when he went down my resume was, he's like, oh, you ran track in college. So did I. And we just instantly hit it off right there. And so that's where I found my mentor after graduate school. That's where I found this amazing father figure type guy and this great friend that always there for me. And so years go by. I worked for him for about 3 years, and then I kind of carved my own path in the Dallas-Fort Worth area, mainly more Fort Worth area. Ran a hospital at one point in time because the rule of thumb, when you work at a hospital long enough, if you're there long enough, they're just going to put you in charge. So at 29 years old, they're like, hey, here's a six-figure salary, and here's to be the administrator, CEO of this hospital. And it was a great job. I had a lot of great employees, a lot of great patients, but it wasn't what I wanted to do. I wanted to be a therapist again. So I went back to being a therapist again and really sharpened my skills. And the whole path between leaving Health Trust at the time to coming here has always been an ongoing conversation. Was, you're going to come back and work for me eventually. You're eventually going to come. You're going to come home. You're going to come home. And so last August, gosh, I'm already going to get emotional, huh? I lost a client in a really devastating way. And for one of the first people I called was Dr. Flowers, and he goes, well, first thing you do is call your therapist. Done.
Yeah.
Next thing you do is you need to go on a vacation. Actually, I have one planned next week. The next thing you do is just take a couple days off from work. I've already done that. He goes, you already know what to do, Chase. He's like, so when are you kind of come home now? And so then we talked about this project here and what this company's grown into. Came down to Houston last August 2019, and I've been here ever since. So it was on the drive down here. My girlfriend Courtney and I are already planning out plane tickets to fly to a football game. It's like we're already going to be here. Like we had already had it in our mind before we even sat down. So, yeah.
Here you are.
Here I am.
Great journey, huh?
Yeah. That's a big mouthful.
And so, can you explain we wanted to talk about your relationships with and your treatment with the families and what you specialize in. Can we touch on that a little bit?
So throughout grad school, you'll kind of always hear me reference back to that. Throughout my time in the field, what I've learned is that people want authenticity.
Right.
They don't want BS. They don't want a textbook. They want you to be authentic.
Right.
And so I've always attempted to be that authentic therapist. And so I have no problem with, in the first hour of meeting a patient for the first time, hey, my counselor's name is Paul. I'd send him to you, but he's full because he's really good. Because it's the truth. Therapists have to take care of themselves too. And so them knowing that you're also a human being is a big part of it. And so in working with families, I have no problem sharing my own family history as well too. The scuffles between me and my brother, or the good and bad parts of my relationship with my parents.
Yeah.
So.
Yeah. Very good.
Very nice.
Yeah.
And, building those trustworthy relationships is so critical to patient success, and it's so important to you. What would you tell other therapists listening today about building an authentic relationship with their clients? How do you do that?
Don't have an ego when you walk in, because it's a working relationship. They're employing you, but you're employing them as your client. And in really listening and just giving time to do that slow turn of the dial in every relationship that you build with a new client. Yeah. You have some clients who come in and they've been burned by some school counselor along the way, or some therapist their parents made them go to. And so your goal is to remember that you need to meet them where they are, hold their hand and walk with them. And there's parts where you drag them where they need to go, but there's parts where it's just, you might need to go slow, and you might have sessions where it feels like a step back, and that's actually a step forward.
I know earlier this year, Kobe Bryant's death had a very significant impact on you. How did his death affect you as a therapist, and how did it impact your human condition?
So it's actually interesting because as a sports fan, I can't stand Kobe Bryant. I'm a Dallas Mavericks guy. I'm a Texas Rangers guy. I'm a Dallas Cowboys guy. So it's weird that I'm here in Houston. And so this has been an awkward year for all of us.
Yeah.
At one point in time, Australia was on fire. We all forgot about that. There was murder hornets. The government told us about UFOs, and nobody even talked about it.
Right.
But I always kind of circle back to Kobe because that was a moment in time as Courtney and I are actually driving down here. My dad always tells me at the time when Elvis died to carbon date me. He remembers exactly where he was when he heard about Elvis dying. And Kobe is one of those deaths too, just like Mike. I remember exactly where I was when Michael Jackson died. And Courtney and I are driving to Houston she's going to go to a job interview. We're going to look at the house we just got. And we're passing through the Woodlands, and we're just driving along, and she goes, "Hey, Kobe died in a helicopter crash." And that made sense to me because I knew he went around in a helicopter. I was like, "Oh, okay." She goes, "Did you hear me? Kobe just died in a helicopter crash." And I was like, "Oh my God." And so a lot of different things in my head at that time, and I just didn't really quite think about it. And then over the next month, we saw the way the leagues kind of surrounded that, but it wasn't stories about his jump shot. It wasn't stories about his championships. It was a story about him as a person. It was stories about the relationships that he built off the court. And you start to see all the film that you never saw before. This one sportscaster said she was 8 months pregnant, and Kobe, first time she met him, walked up to him and said, "Oh my God, how far along are you? You're going to be a girl mom? I'm a girl dad. A girl, that's the best thing." And so seeing Shaq, who he had a horrible relationship with, cry about like how good the relationship actually was, it brought everything back. If it's not about accolades, it's not about things along those lines. It's about relationships that you build in life. And that's truly what matters, because a lot of focuses in therapy that we have with clients is people are so focused on how far behind in life they are, the next goal or the next car or the next house, when it's just the person sitting next to you in the relationship that you need to build. That moment in time right there.
Very cool. Has your approach to therapy changed this year with COVID and everything else that's going on in the world?
So I'll go back to that graduate school reference point again. I remember talking with Dr. Cruz saying, "Man, teletherapy is going to be the future." And then did a few teletherapy sessions over the years, and I'm like, it is not the future. And now here it is, it's the future. What's unique about this, and I'd love to hear your perspective on this too, what's really unique is that this is the first time in my 10 years of doing this that every patient's walked into the office with the exact same problem. Doesn't matter what socioeconomic status, doesn't matter what race, gender identification, sexual orientation, what member of the family you are, if you're just there for support. Everybody has been heavily impacted by whether it's not seeing their grandkids or not spending time with their families or not going on this certain trip. Everybody has been impacted by this in a certain way. And so it's kind of unique in how what COVID has done with therapy.
Yeah, it is. What have you heard from your clients this year? What's changed as far as drinking during COVID or using substances during COVID around the United States?
It's definitely gone up from what I can tell in the trend, and it's something that's happening that people aren't even thinking about. When I ask a client, well, has your drinking picked up since COVID? Well, I guess now that you ask, yes, it has. I find myself drinking earlier. I mean, we could just look at the sales of alcohol and know that. We could go to other states where marijuana is legal and look at the sales of that and see that that's also gone up.
That's right. Yeah.
And just I remember you and I were actually having a phone conversation back in March, and it was right when AA meetings were shutting down, and I think it kind of hit us at the same time of, oh my God, the amount of relapses that are about to happen because that community is gone.
Yeah,
right.
And it has. It's happened a lot this year.
Yeah.
You know, you have several clients a day that you see every day of the week, sometimes on weekends. The patients you see clearly have complex comorbid issues, and helping them improve their quality of life is so rewarding to you personally. But this type of work can affect you as a therapist, be your own human condition, really, and your emotions. How do you manage the stress of seeing the patients and hearing their problems day after day and what they've been through and the complexities of their own lives? And what do you offer other therapists coming into this field?
You know, that's one thing that's definitely always at the front of my mind is self-care. But the hard part of me, unfortunately, my parents programmed me was to just work hard and put your head down. So, you know, I love riding my bike and cycling. Really enjoy, of course, enjoy spending time with Courtney. Spending time with my dogs at home, you know, finding a show on Netflix to kind of binge, but also trying to get out and do the proper healthy social distancing things of going to a restaurant that's doing things the right way, or going out to a picnic, or going for simply just a walk at Memorial Park. You know, I'm starting to take up golf again, which is not cheap. So it's really focusing on that side of it. And then also after each session, just when you're there in the office, try to hit the reset button and remember that each client you have is in a different stage of treatment, and there's different problems that are going on. And reset, write your note, get it out of your head, and take a deep breath and walk to the next one. And then make sure if you get stuck with this client, go back and look at their treatment plan. What are the goals we're working on? Because actually, I'll use a quote I just heard in the last hour. Was sometimes when you're trying to drain out a swamp, you get bitten by a bunch of alligators, and sometimes the alligators win. So we need to go find the plug, remember why we're actually there to get through the muck so we can see what we're doing.
Yeah.
Do you find it difficult to take your counseling hat off at the end of the day when you go home into your own home?
Good question.
You know, it's funny.
Hey, then you have to answer it next after him.
You know, it's funny because my uncle Tim, my dad's oldest brother, is actually a counselor too, and his wife always jokes, well, does he listen when he gets home? And so, you know, for me, I like to think that I do, but you'd have to ask the audience around me, do I actually shut that down?
Yep.
I know there's times when I do check out because I'm in trouble for not listening, but I know there's times that I absolutely put my counselor hat back on at home, and I try to take it off as much as possible. This field, you carry around a lot of your client's emotions sometimes, so you have to find the proper way to shed it. And so that's, you know, either it's visiting with my own therapist or talking with a colleague to make sure I'm not dumping that information at home on anybody that's just like, I don't care, Chase.
There you go. Chase shares the same philosophy as I do, Robin, and that is that we all need a good therapist.
Right.
Yeah.
What do you do? What do you do to shake it off at the end of the day?
Exercise and Netflix and mindless entertainment.
Sky. The new dog.
Right. 13-week-old Italian Spanini.
Spanini.
Yep.
Yeah. Speaking of difficult words, let's go back to somatic symptom disorder.
Yeah.
Okay.
For those who don't know what it is, can you tell us what that is?
So, you know, throughout a therapist's career, one thing I can always say, a good word of advice, is find what your specialty is. Without that, you're just kind of showing up every day aimlessly. I always go back to my first ever client that I ever had, and you and I briefly spoke about him recently. He was at Health Trust, and so right before I started there, Dr. Flowers actually did the intake. And when he did the intake, You know, when I come down to Houston and he's like, here, I just need you to put this file together. And so I scoured through this guy's medical chart. I scoured through his intake. And so I knew this guy backwards and forwards.
Okay.
And he's a 65-year-old gentleman from Waco. I'm working in North Richland Hills at the time. That's about an hour and a half commute, I would say. He would come up on Tuesdays. He would go see the orthopedic surgeon and get an injection, and then in his knee, and then he would go visit with the physical therapist, and he'd sit down with me for an hour. He'd stay in a hotel that night, and he'd do the exact same round again on Wednesday, and then he'd head back to Waco.
Okay.
He comes in and sits down with me, even though I know all of his information. You know, I'm doing the right relational thing. And, hey, tell me about yourself. Why are you here? You know, what happened to your knee? And his story goes along the lines of, I used to be a chef in a kitchen when I was in my early 50s. And then I slipped and fell. And when I slipped and fell, I tore up my knee. So we went and did some injections, and I was on workman's comp. My pay gets cut. And then my life kind of starts to fall apart. But then I get healthy from surgery. And I'm starting to make progress in physical therapy. And then as they went, and so we realized I'm actually backsliding. So now we have to do a full total knee replacement. So he does a total knee replacement. This has turned into a year-long journey for this gentleman. And then after the knee replacement, they're on the big bed in the physical therapy room, and the physical therapist pushed too hard and pushed it down, and it actually popped the joint, like pulled the mechanics out of the bone. So he's damaged now. He is permanently disabled. Texas used to have a great thing called DARS, and the DARS program would help people to achieve a bachelor's degree fully paid for if they couldn't go back to their previous line of work. Unfortunately, that program has since been defunded. But so when he sits down with me, for the last 10 years of his life, he's hobbling around on a cane. His relationships have gone terrible. He's not active in life anymore. He was able to earn a bachelor's degree in social work, though, and so he was able to volunteer at his grandson's junior high as a counselor type. He was able to start reconnecting with his nephew he had a strained relationship with. But each time he came in, he kept telling me the same story of how he got hurt. And here I am, brand new therapist, 25 years old. I can't even grow a beard yet. And he ends up at the 5th session, he's telling me the same story. And I was like, dude, stop it. You gotta stop. And he can't believe I'm saying this. I'm saying this to a 65-year-old man. And I was like, do you know how many times you've told me this story? So, well, it's my 5th time here, so 5. I was like, 12. You've told me this story 12 times. You keep looping back here. Wait, how many times have you told this story to somebody in Walmart? Oof. How many times has your wife told you to shut up? Oh, every day. How many times do we repeat this story when you get back in the car tomorrow and you drive back to Waco? Oof, I will beat myself up the whole way and just starts crying. And it's because somatic symptom disorder it's like, dude, your knee's messed up and I hate it. However, I'll get back to somatic symptom disorder. However, you're wrapped up inside of this. Hey, let's look at the good things here. You got your bachelor's in social work. You're the first graduate from your college, in your family. You get to be around your grandson more. You get to spend more time fishing with your nephew. There's all these. You get to cook at home now as opposed to in a kitchen, and you get to make these giant Sunday meals. Like, you've told me a lot of great things about you too. And this was back in DSM-4 days. This is before the DSM-5. So somatic symptom disorder wasn't fully there, really. It was under a different code. So what somatic symptom disorder is, using him as the whole backdrop now, is every part of his life he put these lenses on, and he saw the whole world hyper-focused on that knee, his pain level, what happened. The next part of physical therapy is going to help me. The next injection is going to help me. I need this different cane because this cane has a shock absorber, whatever it might be. And as opposed to just saying, hey, your knee is hurt, we hear you, the pain level sucks too. But let's focus on the good aspects of life. And then the next day, Dr. Flowers was actually in the office. He came up from Houston that day. And him and I finished our session. We had a much different session than the previous 5 sessions. And he's like, hey, Dr. Flowers. And he's like, what do you think of this guy? Should I keep him around? Should I fire him or not? Because I had been around for probably about 2 months at that time. And he's like, no, he yelled at me yesterday. He did a really good job, and nobody yells at me. And so since that moment, within somatic symptom disorder, within chronic pain syndrome, I get to kind of be raised by Dad here in that area of the field, because that's just what always has been my specialty, you know, going from there into geriatric psych and working with patients in nursing homes north of, don't be upset here, north of 55, but that was just the demographic that was there. However, you know, we worked with a lot of elderly patients that had a lot of physical ailments, and pain was a huge part of that. And so there's a lot of therapists who aren't specifically trained in that area. So I feel very privileged to have gotten that young in my career.
I've always been curious too. You do that board that we put in your office. Talk to me about that. So you have this board that he draws on.
yeah.
And before we got it
whiteboard.
up on the wall, remember he used to take this big, huge sheet of paper on the floor, and they'd be drawing on the floor until we finally got it up on the wall. But tell me what you do there.
So by default, I'm from a family of educators.
Yeah.
I'm also extremely dyslexic. So my second grade teacher told my parents, "You'll never graduate high school." So we found her and sent her a, God, why am I crying about that one? That one's funny. We actually
Come
sent
a long
her,
way.
I know.
Yeah.
We sent her an invitation to my graduate degree because my mom.
That's amazing.
Yeah. My mom said to her, when she said to my parents, like, Chase won't graduate high school, my mom goes, "Oh, it's sad that a lot of parents believe you, but we don't."
That's awesome.
So,
Yeah.
where I love using that board because it helps me to not run down rabbit trails, one. So it's really my tool to help me guide a patient.
Okay.
But also so many patients, when they get wrapped up in an emotion, it's really hard for them to remember exactly what they're saying or how they're saying it, where it's really they get caught in these tentacles of the issue and not what they're actually feeling on the inside. And so if we can write down, like, you just said this, now tell me the feeling that's there. "Oh, I don't want to talk about my feelings, Jason." Well, that's why we're here. And
Okay.
so as I am the guy in the office that will make jokes, as I am the guy that will cut up and have fun and laugh and call you out, I am the guy that always circles back to that emotion because that's what really drives us all.
Right. Yep. So did you guys ever hear from that school teacher?
My mom bumped into her in a grocery store, and she said, she goes, "Do you remember you saying?" She goes, "Oh, I said that to so many parents."
Oh, wow.
Which is
Shouldn't
really
have a
scary.
teacher's license,
No,
yeah.
yeah, she's retired now.
Exactly. Yeah.
So how are you liking living, let's talk about Houston
Okay.
versus, coming from Dallas, and then there's that huge competition, right? And so tell me how the transition's been.
This year's been, well, Courtney and I were really excited about coming down here. This is an
Good.
amazing opportunity, and we were we were really excited to go on this adventure. And we get down here February 1st that afternoon, and then the world shut down. And so it's been us getting out of our comfort zone and being able to go out and feel safe. But we're trying to find the areas of the city to enjoy. We've gone to Galveston several times. We go to Memorial Park pretty much every weekend. Now there's been a transition for me because I was off at school for 6.5 years, but I was home, once a month, once every couple of months. Whereas this is the first time in my adult life where I've been gone and I haven't seen family, and then throw a pandemic in there, so it's made it even harder for people to come see.
Right.
And so it's been, for me personally, it's been a really hard transition in personal life because I'm huge in family, as you've seen me tear up a few times.
Yeah.
But my family support is tremendous. So I have Dr. Flowers and Michael to lean on. I've made some friends in the office. But it's been a great experience for me, this young part of my career, to grow on my own and have support at home with Courtney. But to just know there's somebody a phone call away, but it's different when you don't have that hug, when you don't have that.
Yeah, exactly.
Yeah.
Well, and it's got to be hard because it's hard to make friends during a pandemic, right?
Yeah.
So how are you
So
gonna-
let's throw some of these questions
Yeah.
out there. What do you
Okay.
do for fun, speaking of pandemic?
Eat Courtney's baked goods.
Yeah.
Yes. She's she's a phenomenal baker.
Yeah.
Definitely love to go cycling, taking up golf again, going for walks, things along those lines.
Nice.
And your favorite leisure activity? I guess that'd be
That
under
would,
the same
that would be the
category.
same things there.
Yeah.
Yeah, cycling, golf, going for walks, going for runs, things along those lines.
What's on your bucket list that you haven't done that you want to do?
Bucket list I haven't done. There's two really. Start and finish my PhD. That's a goal of mine, and then the other one is married and having kids.
There you go.
Yeah.
What's your ideal vacation?
Ideal
Post-COVID.
Post-COVID. Or I guess before COVID. But no, post-COVID, ideal vacation. A national park that doesn't have cell phone signal.
Nice.
Oh, nice.
That's how I always try to plan something where there's no cell phone signal. So yeah.
What music is in your playlist right now?
It is all over the place from either like Red Dirt Texas Country to Post Malone to we just recently bought a record player too.
Nice.
So Fleetwood Mac has been played a lot lately, John Mayer, and then there's some podcasts out there too.
Very cool.
Yeah.
Awesome.
Yeah.
Well, thank you for being with us.
Of course.
Really appreciate that. I
Appreciate
think
you
it's
having me.
important to folks, when you see something like this, where as they get to know you and as they get to know Chase, and they go, yeah, that's my therapist, I want him to
absolutely.
treat me once they get to know you. So thank you.
Yeah, you're doing an amazing job. So glad that you're part of J Flowers Health, and so glad you're right here in Houston.
Yeah.
Yes.
And Dr. Flowers, you know this, but I always want to like saying it to you is you've been such a pivotal part of my career.
Thank you. Thank you.
And pushed me.
Yeah.
In hard and bad and in good ways.
Sometimes I think he's leaving.
Yeah.
And
Like,
so
don't leave,
always giving me the butt chewing when I need it, but always told me I loved you afterwards.
That's
And,
right.
Without you, I'm definitely not sitting here in Houston, that's for sure. But absolutely without you, it's I'm very honored to be able to try to follow in those coattails that you leave behind.
Thank you so much. Well, I love having you here, and I love you and Courtney, and can't wait to see what's ahead for you guys here in Houston. So thank you. Thank you, Robin.
And how do folks find us if they would like to talk to either one of you two gentlemen?
jflowershealth.com.
Awesome.
Or 713-783.
783-6655.
There you go.
Thank you, everyone.
Thanks, everyone.
See you
Bye-bye.
next week.